My name is Ed Isaacson, and I'm Human Resources Director for the Archdiocese of Indianapolis. It is my great pleasure to welcome you to your new position with the Archdiocese and to explain some of the benefits we offer to our employees. In your work, you'll be taking care of others, and part of the purpose of our benefits is to take care of you, to provide the things you need for yourself and your family to ensure your well-being. And today I'd like to go through those with you. I'll be referencing a handout that's available on our website. I will go through that with you, and if you have any questions, please, at any time, don't hesitate to contact our office. These benefits are for new employees of the Archdiocese, and they're summarized in the document that we have here. There's a wonderful picture of our Catholic Center at 14th and Meridian Street, and then it gets into our medical insurance. Our medical plan is paid for through payroll tax deductions. These deductions are made on a pre-tax basis, so before taxes are taken out, the deductions occur. You can see what the deductions are for 2020. For single, they're $39.32 per pay period. For family coverage, it's $211.93 per pay period. The network we use is United Healthcare. That's administered by UMR. And when you get your ID card in the mail, it'll say UMR on the card. One of the nice things we do in our plan is cover most preventive services at 100%. So they're provided at no cost to you. This would include your annual physical and any diagnostic tests associated with that physical. So if your doctor wants to do blood work, for example, that's all provided for free. Well baby care, mammograms, your annual eye exams, immunizations, those are all provided free of charge. So we encourage you, for example, to get a flu shot. You can go to any Walgreens or CVS, show your card, and you would get that shot for free. We also provide up to $1,000 per year for smoking cessation and weight loss prescriptions. So if you're trying to quit smoking and your doctor prescribes nicotine replacement, or if you're trying to lose weight and your doctor prescribes medication, we cover that in full at no cost to you up to $1,000 per year. The plan design is shown here on the page, and I'll focus on the column in the middle where it says your responsibility in network. Our network covers over 90% of doctors and hospitals in the state, so there's very good access to those providers. You will see that for single coverage, you have to meet the first $2,500 in cost. In a few minutes, though, I'll talk about our health savings accounts, and the contributions we make to those accounts essentially gets you halfway toward that deductible. For family coverage, the deductible is $5,000. Once you meet the deductible, the plan pays 70% of the cost, so your share would be 30%. And there's an annual out-of-pocket maximum. That annual is a calendar year maximum. For an individual, that's $5,000, and for a family, that's $10,000. So my wife and I have 8 children, and our maximum cost for all 8 of us for medical expenses in a calendar year would be that $10,000. But as I mentioned before, with the health savings account contributions we make, the actual cost is less than that. In terms of finding a provider, if you go to umr.com and click the Find Provider icon, it will walk you through that process. The network we have is the United Healthcare Choice Plus network. So that's important to know when you're searching, so you search under the correct network. We have wonderful resources called plan advisors that are available to you. And these individuals can help you navigate the healthcare plan. So if you're trying to find information about the cost and quality of care, if you're trying to locate providers and have questions about those, if you have questions about claims and you are wondering why a claim got paid the way it did, you can contact the plan advisor at the number there, which will also be the number on your ID card. A new benefit that we began during the pandemic is telehealth, and we use a firm called OC24 that provides free 24/7 access to certified health providers. And these visits are done via video on the web or on a mobile app. It's for non-emergency care, so if you have a medical emergency, you want to seek out an emergency room or urgent care center to take care of that. But for other conditions, and we list some of those, if you're dealing with allergies, asthma, bronchitis, colds or flu, earaches, insect bites, things of that type, they could be a wonderful resource. It's also good to know this is provided to you free of charge. So telehealth through OC24 has no cost to you. You don't have to meet the deductible. It's simply paid 100% through the plan. We have wellness benefits that are described here. We provide a $200 contribution to your health savings account for you and your spouse, if your spouse is enrolled in our medical plan, to do an online health risk assessment and an annual physical with your doctor, where your doctor would complete a biometric form. The year is between January and December. So you could get a physical this year. You could get another physical later this school year, for example, in 2021. That $200 is tax-free and goes directly to your health savings account. We also have a maternity program, which is a great benefit if you are expecting a child. If you are, congratulations. There is an $800 incentive for you to complete the maternity wellness program, and that money goes into your health savings account tax-free. We also have a $1,000 incentive to your health savings account for orthopedic centers of excellence through OrthoIndy, and we can provide you more examples of the services they provide for which that incentive applies. There's a section here on healthcare reform. Our plan is what's known as a grandfathered health plan, because it's essentially the same as when the Affordable Care Act, the ACA, was enacted on March 23rd, 2010. Fortunately, we've been able to keep our healthcare plan very much the same over the last 10 years because we've put different things in place that have been effective in controlling the cost of healthcare, which is good for our employees and good for our parishes and schools as well. Health savings accounts. I want to spend a few minutes on these because these may be new for many of you. You may have had accounts before that were use it or lose it type accounts, where if you didn't use that money during the year, you lost it. Well, savings accounts aren't that way. These are for people who are covered by our health plan. So if you don't elect health insurance through us, you don't get a health savings account through us. We make contributions to that plan, and those are made on a tax-free basis. You can see in the chart for individual coverage, our employer contribution is about $1,200 per year. For family coverage, it's double that. It's $2,400 per year. That money goes into the account whether you decide to save or not. And if you do decide to save, you can do that. The money goes in pre-tax. It would accumulate earnings pre-tax. And then if you take it out for a healthcare purpose, that's also pre-tax. There's no other account like this in the IRS code, where it goes in without taxes, can earn interest without taxes, and then it's tax-free when it's taken out for healthcare purposes. We use Optum Bank as our HSA provider, and these accounts go with you when your employment ends. So if you work for the Archdiocese for a number of years and then leave to go to another employer, whatever is in that HSA will go with you when you leave, so you can use that money in the future. That's a great benefit for people who are retiring. I've met with several of our employees who are retiring who have tens of thousands of dollars in their health savings account that they take with them into their retirement. There's another type of account that's available called a flexible spending account. The all-purpose flexible spending account is for people who do not have our health plan. So for example, if you're covered by your spouse's health plan and your spouse doesn't have what's known as a Section 125 account or cafeteria plan or flexible spending account, you can open one through the Archdiocese. This is a use it or lose it account, where if you don't use the money during that year, you would not have it in the following year. There's a second type of account called a limited purpose account, and these are for people who have our high deductible health plan, the one that I described. You can use this, for example, for dental or vision expenses, or for other expenses that you incur once you meet the deductible. There's a third type of flexible spending account for dependent care. This would be for child care expenses. So what you can do is have money taken out of your check pre-tax. Then as you incur expenses for child care, you can get reimbursed with those pre-tax dollars. In the chart, you'll see the minimums and the maximums for those different types of accounts. We have dental insurance through Delta Dental, which is a wonderful provider. You don't have to pick a dentist in the network, but if you do, there are additional savings you can get. The premiums are shown here for single coverage, $4.56 per pay period. For family coverage, $23.56. That's the same in 2020 as it was in 2019. You can see that Delta Dental has an annual maximum shown in the third bullet point of $750 per person for all services except orthodontics. There's a separate $1,500 lifetime maximum for orthodontics, and we only cover orthodontics for individuals up to age 19. We have two networks. One's called a PPO, a Preferred Provider Organization network, and a Premier network. So if you use either one of those, you'll get additional savings through Delta Dental, whereby there are negotiated rates that reduce your cost for dental care. Of the two, the PPO network has better discounts. So if you're on the Delta Dental site and you're looking for providers, ideally, if you pick one in the PPO network, you're reducing your cost the most. The plan design is shown here in the chart that follows. For any preventative services, the plan pays 100% in full. So if you get your 2 annual exams, there's typically no cost for that. For basic services, if you have fillings or if there is repair to a crown, you pay 20% of the cost after the deductible. The deductible is $50 a year per person or $100 per family. For major services like crowns, bridge work, or dentures, there's a 50% benefit. And for orthodontic services, as I mentioned, there's a $1,500 maximum for those for individuals up to age 19, and it's a 50% benefit after the deductible is met. What you can do is have medical insurance but not dental insurance. You could have dental insurance but not medical insurance. You could have family medical and single dental. You could have single medical and family dental. You can mix and match those any way you like. But the health savings account only accompanies medical insurance, not dental insurance. Let's talk about retirement. And as you begin your employment, you're probably not thinking about retiring. But this is actually the best time to start saving. And we found that even though we offered this plan for many years with a match, only half of our employees were saving for retirement. And when we did focus groups and asked them why, most people said they had meant to, but just not gotten around to it. And that's understandable. There are many things that you're focused on as you begin a new position. What we decided to do was make the enrollment process easy by making it automatic. There's a fascinating book called Nudge by Richard Thaler. He's a professor of economics at the University of Chicago, and he won the Nobel Prize in economics. And he talks about something called behavioral finance. And the basic theory is to design systems to optimize the benefits for participants. And he gives the example of organ donation, which I thought was fascinating. In Germany, about 12% of adults are organ donors. In Austria, it's over 90%. The difference is in Germany, you have to opt in for organ donation. In Austria, you have to opt out. In 2008, we decided to change our retirement savings plan so people save automatically. So as a new full-time employee, you are automatically enrolled and will have 2% of your pay contributed to this plan. Every year, that will increase 1% automatically until you reach 8% of pay, which is the maximum that we match. You can opt out of this at any time if you prefer not to save, or you can increase or decrease your contributions at any time if you wish to do so. The money you put in is always your money, and also the match is your money immediately. You don't have to stay here a certain length of time in order to earn that match. You can see in the chart that follows there that if you choose less than 8% of pay to save, you're leaving money on the table. There is potential matching money that you're not receiving by saving less. So for people who are able to, we encourage them to save 8% of pay and get the maximum benefit of that matching. Studies have shown that if you save between 10% and 15% of your pay during your career, you will have adequate resources to meet needs for retirement in most cases. So what we do here is essentially design a process whereby you can save 12% of your pay within several years after your beginning of your position, really through no effort of your own. It begins automatically, the contributions increase automatically, the matching occurs, and that will allow you, hopefully, to accrue sufficient resources for your retirement. There are several different retirement options available through OneAmerica, which is the company that administers the plan for us. We use as our default option something called MFS Lifetime Funds, which are also known as target date funds. So I'll give you an example. I was born in 1960 and I turned 65 in 2025. So I'm in the MFS Lifetime 2025 Fund. So every year as I get closer to my projected retirement date, the investment mix changes and becomes more conservative. Conversely, if someone is much younger, let's say someone is 30 now, they're in an investment portfolio that has more money invested in the stock market than mine would have because they have more time and they can bear more risk. They call that a glide path, and it's similar to an airplane landing on a runway, where over time it gradually comes down. And in this case, the exposure to the stock market gradually comes down, so that by the time you get close to your retirement, you've got less money in the stock market than someone who may be 10 or 20 years younger than you are. This is something that you don't have to manage. It's a bit of an autopilot approach that for most of us who aren't financial people is very nice. You don't have to go in and tinker with your investments as time goes by to adjust them as you get closer to retirement. There is a fee that is charged. It's $13.50 per quarter. That's the administrative fee that goes to OneAmerica for taking care of our plan. And you can see the website there, archindyretirement.org, where you can log in if you want to make changes to your account. For new hires, they'll receive a letter within the first 10 business days that will give them login information. There's also a phone number there for OneAmerica to access their customer service. Life insurance is provided to you if you work 30 hours or more, and that life insurance is equal to your annual salary. In addition, you can purchase voluntary life insurance, and there's guaranteed issue coverage of up to $200,000 for you, up to $20,000 for your spouse, and up to $5,000 for your children. We have annual enrollment for this, and if you elect this coverage during your first year of employment, it's provided on a guaranteed basis. That guarantee doesn't happen in subsequent years. Daryl Fitch is our contact person, and his phone number and email address are listed there. In addition to voluntary term life insurance, you can also purchase voluntary short-term disability insurance. That will provide 60% of your pay after either 15 or 31 days of a waiting period and continue for up to 90 days. This is something you would elect, and if you choose to take that coverage, it would be deducted from your checking account. Every employee, though, is enrolled in our long-term disability plan. By every employee, I mean every full-time employee who works 30 hours or more per week. Long-term disability provides 60% of your benefit after the 90-day waiting period. So we have cases where people might have a serious illness like ALS. They might be in a car accident and be unable to work. Well, there's peace of mind in knowing that after 90 days, this benefit will kick in and will continue, in some cases, for many years to keep providing you 60% of your benefit of your pay during your time of disability. Any questions about that can be directed to Daryl Fitch, our agent, at the contact information shown on this page. As a church, we are pro-life and pro-family, so we have several benefits that can help you and your family in very unique and important ways. We have what's called an Employee Assistance Program, or an EAP for short, that provides free counseling for you and your family. It can be issues regarding work, family, drug and alcohol abuse, stress coming from other situations in life. All of this confidential counseling is provided to you and your family at no cost for up to 7 sessions per episode or life event. It's not 7 sessions per year, and that's important to remember. There may be an issue at work, for example, that triggers eligibility for 7 sessions. There may be another issue at home that would trigger an additional eligibility for 7 sessions. So the intent really is to provide support to you through each of those situations that you're dealing with. St. Vincent Hospital is our provider, but what they've done is set up counseling locations in all the deaneries of the Archdiocese. So if you are in New Albany, if you are in Batesville, or any other city within the Archdiocese, there is a counseling center close to you. To access that, there are numbers shown here that you can call that will provide that assistance. Those numbers too are answered 24/7. So if there's an emergency and a need to talk to someone for emergency assistance, that is available by calling these numbers. In 2020, we started another benefit called CompPsych. They provide also 3 no-cost telephonic counseling sessions from master's degree or doctoral level clinicians. What you can do too, which is a unique benefit, is speak by phone to a certified public accountant or a certified financial planner about things like getting out of debt, dealing with taxes, planning for retirement, credit card or loan problems, or other financial matters. There is a 30-minute free consultation with an attorney about legal matters. They have work-life specialists who can help you with issues like finding childcare, finding elder care, moving, major purchases, planning for college or home repair. They have online resources on relationships, school, and a variety of topics. They have an online will preparation program under their estate guidance link. And their contact information is shown here, both their phone number and their online information. I'd like to tell you about our medical and family leave policy. We provide up to 12 weeks of leave. That leave is unpaid, but what you can do is substitute sick leave for those days off, or if you have short-term disability, that can provide coverage for some of those days of leave. It's 12 days of paid leave per 12-month period. It's a rolling 12-month period we use. That's available to you after 1 year of service, in which you work at least 1,250 hours during those 12 months. The reasons for family and medical leave are the birth of a child, adoption or foster care of a child, care of a spouse, child, or parent because of a serious health condition, certain military obligations, or your own serious health condition. And those forms are available through Human Resources. Another benefit we provide, again because we're pro-life and pro-family, is adoption assistance. This is available to you after you complete 1 year of employment, if you're at least age 21, and if you're eligible for our health plan. You don't have to take the health plan, you simply have to be eligible by working at least 30 hours a week. It requires a home study through a Catholic Charities agency in the Archdiocese and provides up to $8,000 in reimbursement to cover adoption expenses, or up to $10,000 in reimbursement for a special needs child. Once you leave employment with us, you can continue your coverage for up to 18 months. If you are age 60 or over and have 10 or more years of service, that coverage can continue for up to 5 years. And the costs are shown there on the handout. That applies to both medical and dental insurance. We have another wonderful benefit called PerkSpot. This is an online shopping mall. And I needed a home computer recently. And during the pandemic, I thought it would be wise to shop from my home for that computer. And I went to PerkSpot and found we had discount programs for both Dell and Lenovo for technology, and was able to get a desktop computer for my home for about half the cost I would have paid elsewhere. Other employees have found deals on appliances, travel, insurance, apparel, all different types of things. So we linked up with PerkSpot to create this benefit to help you have your dollars go further. And if you need to purchase something for your home or you're purchasing a gift, PerkSpot might be a good place to check out. All of our contact information is shown here on this page for our various plan partners for our benefits, and also for our Office of Human Resources in blue. At any time, if there are questions that we can answer for you, please don't hesitate to contact us. We're here to serve you, and we are grateful for the service you provide for others. God bless you and all the work you do for the Archdiocese and our parishes, schools, and agencies. You will truly make a positive difference in the lives of many people. We're grateful for what you do, and we're willing to help you in any way we can. Thank you.